Thank you for joining us here on KMR Local 4 News. Right now, the City of Amarillo is preparing to have a briefing about the COVID-19 pandemic. We'll take you live for this breaking news.
Public Health Director for the City of Amarillo. Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Michael Lamentier, Chief Medical Officer for VSA. Dr. Samay Mowad of the Amarillo VA. And City Manager Jared Miller. At this time, we're going to open it up for a brief statement from each panel member, and then we'll open it up to questions from our media. At this time, let me start with Amarillo Mayor Ginger Nelson.
Thank you, Dave. Good morning, Amarillo. One of the things I wanted to highlight today is that gyms and office buildings will be opening under the governor's new order on Monday. And so as a business owner, if that affects one of your businesses, we want to make sure that you're getting that information. And if you need more details, you can contact us here at the city and we can help walk you through what those requirements will look like. I also wanted to highlight that you're seeing changes in the report card, and Casey did a great job at the last press conference walking through what many of those changes are. But even seeing the dashboard come up today, which Casey, I'm hoping you're going to talk to us a little bit about that this morning. I just wanted to say to our citizens how much work goes into putting those products out. You know, if you can think back to what life was like before Corona, all of the city employees are coming to work every day. Their days are full. They have jobs that they have to do in order to keep the city running and operating. They're still doing those jobs. Everything we're doing for Corona is happening on top of the regular jobs that they were already doing. 8 weeks ago, we didn't have any of this in place. We had no daily reporting. We had no 3 times a week press conference. We had no report card that was created just for the sole purpose of keeping citizens informed about where we are in Corona data. All of those systems have popped up in the midst of a crisis, in addition to doing the work that they were already faithfully doing for us as a city. So I wanted you to have that background, and I wanted a chance to say publicly how much I appreciate the work that our city team is doing, especially the public health department team. Casey's leadership and the people that she leads over there, they're very well trained, and aren't, because right now we're relying on the training that they've invested in. But more than anything, they're extremely dedicated to keeping our city safe and to putting out information like this on a daily basis, many times over the weekend, just so that we can be more informed as a citizen. And you may have a difference of opinion about what information should be on the report card, and I respect that. But at the same time, I do to appreciate the volume of work that it takes to put this product out, both in the communications department. Jordan and Dave and their team, Jesse and Taylor, have done a fantastic job, and they bear a lot of the burden of getting this information out too. But the information that we put out is as we can present it to you. Accuracy is one of the most important things, but we also try to keep summarizing it in a way that's useful, and the situation is changing, so that's why the report card keeps changing. How can you help? I have citizens asking me all that all the time. What can I do as a citizen? How can I help the city during this time? And I want to ask you for a very specific action step this morning, and I think it's something that every citizen can do multiple times, and it doesn't cost you anything. How's that for a lead up? I want you to thank a city employee. Many of our city employees do wear a uniform, and you see them out and about. You see them at convenience stores and grocery stores. And if you see a city employee, would you please just stop and thank them for what they're doing? A second thing on that is, if you read something that gives you pause, you read something on social media, or you hear, just through coffee shop talk, a friend of yours says, well, the city's doing this, and it causes you to pause, and you think, well, that's strange, or I don't agree with that, or why would they do that? Then I would ask you to verify it before you assume the worst about what's happening in the city, about decisions that city staff are making, or even that city elected officials are making. I would ask you to verify it. Don't assume the worst about what's going on, and please don't believe everything you hear. You have many sources to verify information about what's happening at the city. An example of this that I've seen recently is somehow, somewhere, someone started a story that the city was using coronavirus emergency funds to build a water park. This is absolutely not true. But I need for citizens to engage, and instead of having doubt, I need them to assume the best about our city and then verify. And here's a great way for you to verify any information that you hear or any question that you have. If you read something on the report card and you have a question, if you read something on social media about a change in the budget and you have a question, you can use this email address to verify or to ask a question. That email address is publiccommunications@amarillo.gov. So it's plural, publiccommunications@amarillo.gov. And so I would answer you as a citizen. What can you do to help our city? You can thank a city employee when you see them. And then you can verify or ask questions using that email address. And that would help us just to get good information. We do it through the press conferences. We do it through many avenues. But if you want to verify information, that email address is a great way to do it, and we can get you a quick response off of that email address. So thank you for your help as a citizen, and thank you for helping me to show our gratitude as citizens to our city staff that's working so hard for us during this crisis time. Thank you.
Thank you, Mayor. This time we want to go to Public Health Director Casey Stoughton.
Thank you, Mayor Nelson. Our team appreciates those words of encouragement. As of yesterday, there were a total of 1,745 cases of COVID-19 reported in the Potter-Randolph County area. 1,327 of those cases were in Potter County and 413 cases in Randall County. We have a total of 337 recoveries, of which we are all happy about each recovery. There are a total of 20 deaths in our community in Potter and Randall counties, and that leaves us with 1,388 active cases. I'll take a minute to talk about the numbers. On the City Council meeting yesterday, I reported 388 recoveries and 1,387 active cases. As Mayor Nelson talked about our data, the data that we report out is provisional. So we are always cleaning the data. We're always going back through the data to make sure that the data is accurate. Sometimes when it comes in, it may have somebody who lives in Canyon, but it may indicate Potter County. And so as we go back through that data, we're always cleaning that data. And so we want to make sure that that you know that there may be minor adjustments here and there. And so that is an important piece to know because we want to always make sure that we're reporting the most accurate information at that moment, but we are also always cleaning and making sure that the data is the most accurate that we can. And so those two things may not always coincide, just like yesterday with 337 recoveries or 338 recoveries, today 337 recoveries. That person was still recovered. We just likely moved them over into the what we call the out of jurisdiction category. And so they don't live in Potter Randall County. So there's a constant shifting and cleaning of data that occurs. The numbers reflected on the 230 report card will look different as we have received additional information today and our staff are inputting that data now. We are beginning to see test results from the testing that was provided at Tyson last week. We appreciate the partnership at Tyson. They've done a great job in supporting their employees in our community. Yesterday's report card reflected 155 positive test results. That was from the testing last week. Today's report card will reflect an additional 255 positive test results. It's also important to mention that there were 843 negative test results reported to us. So I think that's a very important number as well. 1,380 test results have returned out of the 3,587 total tests conducted at Tyson. Staff at Public Health are making contact with each of the people who have a positive test result. And as you can imagine, this is a big job. Staff at Public Health and at Tyson are working around the clock to make sure our neighbors have what they need to be safe and healthy. Drive-through testing does continue today. It's provided by Amarillo Public Health and Texas Health Science Center. It continues until 3 o'clock. You can call 378-6300 and our call takers will screen and direct you for testing. We also expect the CDC team to complete their work and provide reports likely by the end of this week or early next week. We appreciate that team's collaboration and support. We have a lot of things going on, you may have noticed. You can also visit AmarilloAlerts.com to see our newly live COVID-19 dashboard. We're really excited about that. And we have a big thank you to Anthony and Kirsten from IT and Public Health for their effort. You'll notice a map in the upper right-hand corner of the dashboard. Right now, that map just highlights Potter and Randall counties. We're working to populate this map with zip codes so that that information will be helpful to you, we hope. We appreciate your feedback and your patience while we work through technology and different avenues so that we can get information out to you. That's all I have, Dave.
Thank you, Casey. This time I want to go with Dr. Scott Milton.
Yes, good morning. Just wanted to reemphasize that when you're out in the community, please remember to wear a mask. That is a way of reducing the transmission of this virus that's highly contagious and certainly reduces the burden on all the people at the health department that are working so hard. Try to avoid being in large groups and congregating. And then finally, I just want to touch a little bit more about remdesivir, which is the drug that I mentioned earlier in the week. It looks like this community is going to receive some remdesivir, we hope today. We've already been in contact with both hospitals and with the specialists that help take care of those individuals. And we are beginning to identify individuals that may be a benefit from that small amount of antiviral medication that we're receiving. So other than that, that's really all I had to say this morning. The convalescent plasma is ongoing. I don't have any new numbers for that today, but we are still seeking donors for that as well. So thank you.
Thank you, Dr. Milton. This time I'm going to go to Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital.
Good morning. To start on a high note, it is Hospital Week. And what a better time to celebrate our hospitals than now. I would like to personally thank our Director of Marketing, Martha Del Toro, and her staff for setting up a bunch of fun activities this week to celebrate the commitment and hard work of our hospital staff at Northwest. Let me start with the numbers. Right now, we have 38 positive COVID patients in the hospital and 7 PUIs. Now, this is the lowest number of COVID-related patients we've had in this hospital in over 3 weeks. Right now, we have 17 of these patients are in the ICU, and 12 of them are on ventilators. All total, right now, we're using 16 ventilators out of the 40 that we have. So really still showing a lot of resource in that sense of what we can use if we have other patients come in. Just to talk a little bit about that remdesivir that Dr. Milton mentioned. So, after that drug showed promise in several studies, Gilead, the company that makes it, offered to make a distribution. And I know all the hospitals in Texas were encouraged to apply for some of this distribution. I know BSA did, we did. Unbeknownst to me, how they decided how to distribute this, there are 15 hospitals that are going to receive this in Texas, and Northwest will get 2 cases today of this drug. Now, as Dr. Milton said, 2 cases amounts to about the treatment for 6 to 12 patients, depending on the dose these patients need. We've also been told that that's all we can anticipate. So we're going to work very closely with Dr. Milton and all the other caregivers in the community as to how to best and judiciously use this precious resource for the patients in this community. We've started yesterday or Monday, we started our elective procedures at the hospital. That's going well. Now, at the same time, we're making sure that we continue to allocate space as per the governor's requirements for COVID patients if they come in. In terms of PPE, right now we're doing very well, and we do feel very confident that we will be able to provide the PPE for our hospital staff and our medical staff during this time and continue these elective procedures. So we're excited to have a lot of our staff getting back to the positions that they were in before the virus pandemic here. And we feel very delighted that we can offer patients now a lot of the procedures that many of them have been waiting for a long time. So that's all I have for this morning. Thank you.
Thank you, Dr. Weiss. This time we're going to go with Dr. Michael Lementier, Chief Medical Officer, VSA.
Good morning. Thanks for letting me join the press conference today. To everyone that's watching and participating. I would have to share a similar theme that Dr. Weiss mentioned regarding the number of inpatients we have now that are positive for COVID-19. We have 39 confirmed cases in-house today. Consistently, we've had about 50% of those patients requiring ICU level care. And of those that are requiring ICU level care, it's been pretty consistent that about 50% of those are requiring mechanical ventilation on the ventilator device. It's been a composite of those patients in the ICU as well as those on our med-surg units that makes up our total. And we have a dedicated unit on our med-surg floors and wing, if you will, that houses those other patients that don't require ICU level care. Our nursing staff, our respiratory therapists, our physicians are doing an outstanding job of managing those patients on those areas that we're trying to ensure that we cohort them so that we can conserve PPE. We can get practices really kind of hardwired in how to manage those patients, how we hand off drugs, how we attempt to give optimal time in the patient room, but also attempting to minimize staff exposure as much as possible. So our staff's doing a great job there. And as that relates to Hospital Week that was mentioned by Dr. Weiss, I would like to thank our VSA staff for all the outstanding work that they're doing in managing these patients since the outset of this pandemic. I'd like to bring up another point. It's been shown in our demographics, when we look at the age groups of individuals that are infected, the decades that are greatest in our community appear to be 30-year-olds, 40-year-olds, and 50-year-olds. Those are the individuals in those age brackets that are coming back with the most positive test results of all those that have tested positive in our two main counties. However, for the patients that we're admitting, it's really those that are in their 60s, at least at BSA, that have been admitted most frequently. Close behind that is the decade of the 50-year-olds. And then close behind that, actually, it jumps to the individuals over age 69. So again, I think it's a situation where we don't want to become complacent with what we're talking about with this virus as we open up the city, as we do the good things that the mayor and Dr. Milton have mentioned in terms of proper masking when we're out in the community, and also potentially getting any kind of false sense of security that we are not going to get severely affected by this virus. We have to take proper precautions. We're very happy that the number of inpatient cases have remained steady over the past 3 to 5 days. And looking at trends in our area, it looks like the 3, 5, and 7 day trends have been looking more favorable. Although the very large testing we've done at some different facilities that have been mentioned by our public health officials, I think is part of the reason why we're obviously seeing the large uptick in positive numbers. We now have more ample test kits that we've been receiving for our Cepheid device, which is our rapid PCR. And we're, again, prioritizing those tests for inpatients so that, again, we get the most rapid turnaround of the results. It's allowing us to keep those patients that are under investigation quickly demarcated to either positive or negative, which is a huge help for us in terms of conserving resources. I'd like to thank Dr. Milton and his team for all the hard work they've done to help get us remdesivir in this community, and our staff in terms of applying to the state for those resources. Again, it appears that no drug is a miracle drug when it comes to COVID-19 thus far, as you hear on the national news and by our national scientists. However, this drug does show some promise, and hopefully we'll get some benefit for a few of our patients. We've also continued to enroll patients in the plasma study. We've had about 25 patients enrolled thus far. We'll have to look at that data at the end of this entire pandemic and how the plasma trial, how remdesivir and other therapies affected our patients here in Amarillo that received those novel therapies. I think that's the really gist of what I wanted to convey today. Again, we appreciate everybody's hard work across the entire community and region. I think we're doing a very good job of handling this pandemic, and we're very thankful for our BSA staff.
Thank you, Dr. Lementier. Now I'm going to go to Dr. Moawad of the Amarillo VA.
Good morning. I am Dr. Sam Moawad, Chief of Staff and Acting Medical Center Director for Amarillo VA Healthcare System. As of today, we have 2 COVID-19 veteran patients in-house. One is in our ICU and the other is in our medical surgical floor. Both of them currently do not need ventilators, and they are going to receive treatment of remdesivir. We are going to receive the medication tomorrow morning, and we're going to start these 2 veterans on the antiviral treatment. We also have 10 patients who are COVID-19 quarantined at their home, and we have 1 PUI in-house at the hospital here, and 4 PUIs quarantined at their home. When it comes to our staff, we currently don't have any COVID-19 positive staff, but we only have 1 PUI staff member of Amarillo VA Healthcare System. We have adequate supply of PPEs and ventilators. A few weeks ago, we have tested our community living center or nursing home residents. We tested all the residents, we tested all staff members, and all tests came back negative. This type of asymptomatic sentinel surveillance is very helpful to mitigate risk in our vulnerable population with high risk to contact the virus with associated comorbidities and possible mortality. So that's good news for us that all of them came back negative. Along the same lines and along the same lanes of effort, we know that our veteran resident at the State Veteran Nursing Home had been tested over the last few days by the state of Texas through the STAR program. And I think in continuation of this effort, we know also that we did the same thing, which is sentinel asymptomatic surveillance at the meat processing plants. And that's the right thing to do. And I think that will help us to control the source of infection. Actually, as a matter of fact, I am very hopeful because I will reflect the same remarks made by Dr. Weiss and Dr. Lementier. When we started this journey fighting this virus, little we did know at this time. But right now, we have been through this for 2.5, 3 months, and there is promising treatment. We saw patient recovered. We see the silver lining right now. We think that in the next few weeks, we will have some good news and will stabilize. Right now, we are planning to reopen the facility and open elective surgeries. Our Lubbock community, I think they are already on the right side of the curve. So we might open our outpatient clinic in Lubbock a little bit before Amarillo once we receive guidance from our central office and our leadership at the Vision 17, Heart of Texas. Here in Amarillo, we have a solid plan to reopening the facility, but we will be watching the numbers over the next few weeks. And I'm very hopeful that we're gonna come to the right side of the curve over the next 2 or 3 weeks, and we'll be all in a good shape. One of the positive things that I like to report is when we look at the infection fatality rate in Butler County, it is 1.44%. For Randall County, it is 0.79%. For the state of Texas, it is 2.77%, which means we are doing better than the average fatality rate for the state of Texas, even in the middle of this uptick. So I want to thank every one of you, the city manager, Mayor Nelson, my colleagues, Dr. Weiss and Dr. Lamentier and Dr. Milton for their hard work on that. And also I want to thank our veterans and residents of the City of Amarillo and our citizens in the City of Amarillo, because they are taking to heart the guidelines and recommendation, and they are following them in terms of wearing masks, social distancing, hand washing, and all of these good measures. And I think we're gonna move forward in the next 2 to 3 weeks to see our community going to the right side of the curve. Thank you for giving me the opportunity to share this information with you.
Thank you, Dr. Mullen. Now I want to go to City Manager Jared Miller.
Thank you, Dave. Just want to remind everyone again, we've been talking about Amarillo alerts. I've been reminding people about Amarillo alerts the whole time we've been doing these press conferences. Just want to remind you one more time. The city recently announced a new emergency notification system to provide current and factual information on a variety of topics, including COVID-19. I want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com so you can stay informed. As of this morning, we have 5,792 people signed up for the alerts. I want to note that we will be conducting a test of the system tomorrow at 11 a.m. So this will be the first test of the system. So everyone who has signed up will receive this test communication. Also, I want to echo what Casey said earlier. The drive-through testing center remains open. If you feel sick and you have symptoms you think may be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center, and they'll send you on and tell you how to go take advantage of that test. I want to also continue to thank Merrick Pet Care for the partnership in donating all the food necessary to provide the drive-through pet pantry. Tomorrow, we will have the pet pantry open at Thompson Park from 3 to 6 p.m., 3 p.m. to 6 p.m. This is going to be the last day of the drive-through pet pantry. Going forward, Animal Management and Welfare will continue to support the needs of our community's animals. For questions on current shelter operations and services they have available, please call 378-9032. Also want to provide update on the Governor's Executive Order GA-21. So as you know, on May 1st, a number of services were reopened. That included in-store retail services, dine-in restaurant services, movie theaters, shopping malls, museums, and libraries. And then on May 8th, that reopening was expanded to include cosmetology salons, hair salons, barbershops, nail salons, tanning salons, and swimming pools, private swimming pools. And then on this coming Monday, May 18th, that's going to expand to include office buildings, manufacturing service, as well as gyms and exercise facilities. All of those services that have been open from May 1st, May 8th, and now May 18th are going to be subject to a 25% maximum occupancy based on their permitted occupancy. We expect the governor to provide more information and possibly even a replacement order on Monday, the 18th. We will obviously communicate that out to everyone as soon as we are aware of what that order is going to include. And that's all I have, Dave.
Thank you, Jared. This time we now want to open it up to questions from our media.
And we'll continue with the coronavirus coverage online and on air. For right now, we'll send it back to regular programming.
Focused a lot lately on the meat packing plants all across the country. Another area that has been problematic as far as concentrations is nursing homes. Do we know, Casey, if you find, first of all, have families notified whenever you guys discover a positive case in a local nursing home?
That would be the process at the nursing home itself. So I do believe, yes, that they do notify family members.
Okay, so the health district does not, no role in that. You just notify them there's a positive case.
We work with the nursing facility, yes, and then I believe that they're the ones who notify family members.
Okay, that's all I had, Ruth.
Thank you, Roger. This time we'll go to, if I'm not mistaken, Aaron Langston of KEMR Channel 4. Aaron, how are you?
Yes. So many of the people tested were asymptomatic. And so that's why it's so important to wear a mask, stay 6 feet away from one another, stay in your home as much as you can. All of the things that Dr. Milton has talked about at every press conference are so important for this very reason, because we do have asymptomatic transmission occurring.
And it highlights also how grateful I am that the state gave us additional testing resources. You know, in a perfect situation, we would be able to, all of us, be tested regularly so that we would know if we had the virus, even though we were asymptomatic. If we did that, we could more easily open schools, and every employer could, with more confidence, take care of employees and the customers coming into their business environment. But we don't have unlimited testing resources, and so we've been limited to testing only symptomatic people, with the exception that in this hotspot area, in this one employer, we were given the resources to help them and to help our community with testing asymptomatic people in that environment. And yes, there are many of them that are testing positive. So it's just confirming for us that we are encountering people who are asymptomatic. They don't know they're sick, but they have the virus, and they're at the grocery store. You're encountering them. And that's why it's so important to wear a mask. You could be that person. You don't even know you're sick. Or you could be, 6 feet away from someone in line at a store and not know they're sick, and they don't know they're sick. So it's so important to wear a mask. You're wearing a mask to protect yourself, but most importantly, you're wearing a mask to protect the people that you come in contact with.
So yes, the governor has issued guidance that nursing homes, 100% of nursing home residents and staff will be tested in the coming weeks. As far as expanding that out further, we haven't received that guidance. I think the mayor did a wonderful job explaining why. Just testing supplies aren't available to test everyone, but there are vulnerable populations, and so it's important to make sure that those people receive the tests that they need, just like Dr. Lamentier mentioned. We're seeing the largest numbers of cases in people who are 30, 40, 50 years of age, but the people who are experiencing the greatest consequences of the disease are in those people who are over age 60. And so it's important that we are protecting vulnerable populations and people who are in larger workforces where there may be a hot spot. And so I think to answer your question, yes, there will be testing of nursing homes coming up shortly. So our local morgue capacity is fairly robust. We also have the resources through other agencies like the RAC and other agencies to bring in additional resources. So I think we would have to be in a pretty significant place to have overrun our capacity, but others may have other statements that are on the line as well. But I think right now we're doing a good job in that area, which is again why we want to make sure everybody knows it's good to wear those masks so that you can protect other people. Staying 6 feet apart and good hand washing are vital during this time.
Thank you, Erin. This time we want to go to David Gay of the Amarillo Globe News. David, how are you?
I am good. Good morning, everybody. Hope everybody's doing well. I guess my first question would be for Casey. With this recent increase of positive cases, and with that, the increased need for contact investigations. Has the public health department received any additional help from the state yet that we requested a couple weeks ago?
Yes, we have, and we appreciate that. We've also increased our staffing through temporary staffing. And so we appreciate that staffing. They've done a wonderful job. They've learned very quickly and are ready to go. And so every time we see an increase in cases, then we're able to increase our staffing. And so we're excited about that. We've also moved some of our operations over to the Civic Center so that we can maintain that social distancing here. It's important that our staff stay healthy. So our team are wearing masks and staying 6 feet apart. And so that has added some interesting challenges to the group, but like everyone else, it's just part of doing business right now. And so, yes, we have increased our staff to accommodate the increase in testing and positive reports.
So, and then with that, I mean, so are you, I guess for lack of a better word, are you guys good right now on the amount of staffing that you have to successfully complete and contact everybody with a positive case on a daily or daily basis?
You know, it's a big job, and our staff are working tirelessly. I appreciate the support of the city and the opportunity to make sure that we do have enough staff. And so when we have the need, we are able to reach out and to bring on additional staff. So the answer to that question is probably yes and no. Right now, we do probably have enough staff. We're also, every day we have additional cases. And so we're constantly reevaluating and look at our staffing so that we can bring additional staff on as needed.
Absolutely. Thank you for your answer. I guess my next question would be for Dr. Milton. You know, with hearing, these numbers coming from the hospitals and from the VA as well, is there any, do you have any, I guess, additional information on when you think the peak will happen, or any additional guesses on when that could happen for our city regarding the COVID-19 pandemic?
Yeah, so that's you can answer that in a lot of different ways. What I'm hoping that we're seeing here over the last several days, and from listening to Dr. Weiss and Lamentier, you can see that our numbers and our resources that are being utilized in the hospital has decreased. So to me, that implies that the social distancing and all the efforts that were made a month ago are starting to really show the benefit. And of course, from the start of this, that was our biggest concern, is that we didn't want to outstretch the resources of our hospitals. And so I'm in a much better position, and I think, to say that we are making headway there. Now, when you talk about peaking in the community, a lot of that has to do on your ability to test, and a lot of this discussion this morning was about our being able to test individuals who are asymptomatic. Probably there are at least 5 to 10 more times more people that are actually infected in the community than we're actually testing, and so I think that as time goes forward, the strategy would be that we continue to do as much testing as possible, and we continue to try to maintain our social distancing and those other practices, and that we hope in the future that there will be more therapeutics that will be even more effective, and then lastly, the development of an effective vaccine. And I think Dr. Fauci yesterday was on the air talking about the efforts being made to develop a vaccine. That's still probably 12 to 18 months away. And so those, I think that's the strategy going forward. I do expect that we'll continue to see more cases as we're able to test more. And but as long as we're able to stay up and keep our hospitals running efficiently and not overtax them, then I think that we're going to be okay.
Absolutely. And I guess I want to ask the representatives from the hospital on this as well. I mean, those comments from Dr. Milton, I mean, are you guys seeing that in the hospitals as well? And I mean, is that in your opinion the approach that needs to happen for the I guess to keep the hospitals running smoothly through this pandemic?
Yeah.
Go ahead, Mike.
Go ahead, Brian.
Well, so I mean, again, I think as Dr. Milton said, we found it encouraging that the last 3 to 5 days, certainly we have not seen a growth in the number of cases in our hospital, and have, if anything, seen a diminution of those. And I agree. I think it's still critical that all the measures that we've been doing to prevent the spread of this virus must continue. And even as we open up businesses, which is obviously very important, but everyone's got to take the responsibility of keeping this contained. Because yes, so far so good, but a surge, particularly from any of these larger facilities or from the community itself, could very rapidly turn things around and get us right back into a situation where we're constrained by limited resources. So yeah, we're encouraged by it, but as far as I'm concerned, we're by no means out of the woods yet.
Yeah, and I would concur with those comments, both from Dr. Milton and Dr. Weiss. We're very happy to see that over the past 3 to 4 days, and I'll emphasize 3 to 4 days, we've seen inpatient numbers stabilize. We feel good about our capacity, both in terms of intensive care unit beds and also in terms of testing capabilities, in terms of ventilators and equipment and PPE. With that being said, we must move on in terms of individuals that need certain procedures and surgeries. So the abiding by the governor's order in terms of bed capacity for COVID is critical, but we also can't continue to put off elective cases that are deemed elective, that are truly in some sense not really elective, meaning some patients can't wait for certain procedures that need to be done to help reduce their morbidity from illness if the procedure is not moved forward with. So all those things are the questions that we're trying to address on a daily basis, and that we have allowed ourselves to open up to a degree where we're preserving the necessary beds and resources, but also moving forward for our patients in the community that need certain things done for their health and their well-being. So if we're not being careful about what we're doing in the community beyond that, the risk for us having a resurgence is certainly going to be there. So I think cautious reopening, careful practices, good hand hygiene, attempts at social distancing are all things that we're going to be living with for quite a while.
I think the outcome of the next few weeks will be incumbent on all of us as citizens as we follow the guidelines provided by CDC and by the city. If we do continue to do social distancing the right way, if we continue to wear masks, we're going to see good results in the next few weeks. So we need to be listening to the state authorities as citizens, and I think the outcome will be great. I'm very hopeful.
Absolutely. Well, that's all the questions I have. Thank you all for your answers. Stay safe. Thank you, Dave.
Thank you, David. This time I want to go to Ariana Martinez, Channel 10. Ariana, how are you?
Good morning, everyone. Will there be more testing at Tyson to find cases that developed while we were waiting for the first round of results?
That's not planned at this time, but all our drive-through testing is always available to people who are sick. And so if people develop symptoms even after they test positive or negative, then we'll be there to support our community any way we can. And so again, the answer is yes and no to that. So no testing is not planned at the Tyson plant, but our testing is available at the drive-through testing site.
Perfect. And what role will the city play in testing at senior facilities?
Those plans are developing now. The information came out from the governor just a couple of days ago, and there's more information coming now. So there will be more information as we move forward through the development of those plans. And so I think we'll have more for you on future calls.
And you might not know this yet, but do we know when we'll start doing those tests?
I don't. We're still working on those plans, and so I think we'll be able to make sure that everyone knows and that you guys are aware of that as soon as we have that information.
Yeah, just to have a little bit more clarity on that, we're working through some coordination calls with the Texas Department of Emergency Management and the Office of the Governor today. So, and that will likely be a multi-day process to get the final plans lined out, because this is a statewide directive from the governor.
Perfect. And are the CDC and Texas National Guard personnel still here? And if they are, what are they doing?
So the CDC is still here. They're finalizing their reports and plans and working with our teams both here at the City of Amarillo and Texas Department of State Health Services. So we should have those reports late this week or early next week, and we'll be able to communicate that once we have those plans or those reports, I should say. And so they're still working on that, on those reports right now. As far as the Texas Military Force, Jared, or you may be able to answer that question. I don't know if they're still here or not.
I'm not aware if they're still here. I know their deployment was scheduled to end either today or tomorrow, and we have no indication of a follow-on deployment at this time.
Okay. And then do we know of any other testing at meatpacking plants?
I don't know of any, but I think the Texas Department of State Health Services would be the next best contact for that, because those meatpacking plants fall into their jurisdiction since they're outside of Potter or Randall counties.
Perfect. And I know that Moore County is obviously outside of our jurisdiction, but do we know why Tyson was chosen and not JBS for testing?
Tyson, they weren't chosen necessarily. They in partnership with the Amarillo Public Health Department agreed to do it, and so we offered and they accepted. And so it wasn't a directive. It wasn't a directive. And so we appreciate their partnership and their willingness to make sure that their employees are safe. And they chose to do that. And we appreciate their choice to make sure that their employees in our community are as safe and healthy as we can be.
And I appreciate the partnership with our state relationships that made those testing resources available to them. Am I correct, Casey, that was done at no cost to those employees and at no cost to that employer? So it was an amazing partnership of state resources. And once we were able to secure those resources on behalf of the city, they were offered to Tyson, and Tyson said, yes, we want to use them. So I think, again, I'm just so very grateful for those additional testing resources. And Casey, do you know if other jurisdictions offered testing to other meatpacking businesses? That's probably a question for DSHS.
Yeah.
Okay. Well, that's all I have, everyone. Thank you.
Thank you, Ariana. This time I'm going to go to Ramon Godoy, publisher of the El Mensonero newspaper. Ramon, how are you?
I'm doing all right. Good morning, everybody. I have a couple of questions. Casey, you mentioned out of 155 positive cases came yesterday and 255 comes today. 843 cases were negative, right?
Yes, sir.
Okay. You mentioned we're about 3,400 cases, tests performed on Tyson. That means we have about 40-some%. Out of that 100% came already, we got 50% 2 days positive cases. Is that correct?
Yes, so we still have around 2,200 pending. So we're waiting on the results for about 2,200. And y'all, I have a confession. I can remember every name of everybody that I went to school with throughout elementary, but math is not my strong suit. And so if I'm asked to calculate a percentage on the air, you can see me getting red right now. I just can't do it. And so I apologize for that. I am blushing now. And so Ramon, I'm going to pull out my calculator and help.
I already did.
Okay, great.
1,253 reports. We got about 400 positive. That means we have about 50% positive.
Yes, yes, it was at 48%. Yes, sir.
And then what is the next step?
So we're waiting on the additional test results to come back, and we appreciate the state giving us both the positives and the negatives, because the negative test results matter just as much right now as the positive test results. And so we're waiting on additional test results to come back. And in the meantime, our staff at Public Health are making contact with all of the people who are positive so that we can make sure that they are isolating in their homes and that they have the resources to do that successfully. And so if people have food needs, then we have resources to make sure that we're able to meet their food needs. There's resources in our community for other social needs. We're also working with Tyson to make sure that anyone who is positive but was still at work before we got the test results back, that they're pulling those people, that they're alerting those people and sending them home. And so we appreciate the partnership with Tyson. We appreciate the partnership with the state, who are getting those test results back to us fairly quickly.
Okay, if we got 50% and the trend continues as well, getting 50% at the end of these 3,500 tests, we are talking about 1,500 people positive. If one of the doctors mentioned, Dr. Milton, I think he mentioned is between 5 to 10 people, the ratio to contact from the sick people. We are talking about 15 to 30,000 people sick out of that people. Are you aware of that?
At Tyson?
Just from Tyson.
Or just in the community?
In the community. I mean, Tyson, let's say we have 1,500 positive cases. If you multiply for 5 or for 10.
Can I make a couple of comments about that?
Sure.
So we knew that obviously that the Tyson facility, like many meatpacking plants across the country, were areas that were having trouble with COVID, and we would expect to have a high percentage of both those individuals positive. The demographic of those individuals are that they're generally healthy people. They'd have to be healthy people to do that kind of work. So you mentioned that there was 15,000 or so people that would be ill from it. That's not necessarily the case. You know, as we've mentioned, there's a large number of people that are asymptomatic but still able to transmit the infection. So this population at Tyson, a significant number of those individuals were actually feeling just fine, but were positive and could be shedding that virus to other individuals. So that being said, I think generally speaking, if we look at the population as a whole of the city of Amarillo, it's fair to say that of the amount of testing that we're doing, 5 or 10 times that number of people probably have been infected. You know, that's you can look at that nationally and even globally. So the numbers that we're seeing are the people that we've tested. It's not necessarily all the people that have been potentially infected and could be spreading asymptomatic. And it goes back to what we've talked about that's so important, which is to try to wear a mask for that reason alone. Does that help?
Well, actually, let me tell you, if we consider Amarillo got around 200,000 people, and we perform already 10,000 tests, we are talking about 5% of the whole population.
Mm-hmm.
If we consider 10,000 people has been tested, and 3,000 are tests from Tyson, and we got 50% cases, that means something, right?
Well, and I think it's hard to draw a conclusion. I mean, so yes, so 50% of the tests that have been reported back to us so far have been positive, but that's not all of the test results yet. And so as we start to get test results back, we'll be able to see what that percentage positive truly is. Right now, that's what's been reported, but it's not the total number. And so I think as we start to see, as reports come in further, we will know what that true percentage positive is. Because if you just look at what today's numbers have come in, with the 255 out of 483, it was like 27%. And so I think you can make the numbers do, you can move the numbers around to make them whatever you need. And so I think we need to make sure that when we get all of the positives back, then we can make a more accurate statement about what the true percent positive is.
Yeah, I think we can draw conclusions based on the number of positives that come out of the asymptomatic testing versus the symptomatic testing. However, one thing that we do know is that we don't have the capacity to just be able to test asymptomatic people even now or previously. So we do have to take prudent steps that have been recommended by Dr. Milton and doctors across the country, including the CDC. We do know that there is asymptomatic positives out there. We do know that they can shed the virus, as Dr. Milton was saying. That's why it's very important when you're out and about, when you're interacting with people that are not your family, that you're wearing a mask, not so you don't catch it from them, but so you don't share it with them. So as the mayor said many times, your mask protects me, my mask protects you. That's really the main conclusion that can be drawn at this time.
Casey, one more point on that. We report on our report card the tests as we know they've been conducted. But if we don't conduct the test and it comes back with a negative result, there are doctor's offices, and even if that test was conducted even at a hospital setting, we don't get reported a negative result. We only get reported a positive result. Is that correct?
Yes, ma'am.
So the total test number on our report card reflects the tests that the City of Amarillo has conducted, plus the positives that we know were reported by other medical sources out in the community that were conducting tests. But they are not actually a total number of all tests conducted in the city, because there's not an information gathering system that would tell us every test that's done. They only tell us if it's positive. Am I right on that?
Yes, and so that number and the way it's phrased even is total number of tests reported. And so those are the numbers, those are the total numbers of tests that have been reported to public health, not necessarily the total number of tests conducted in our city.
Yeah, and that's just because, again, going back to all of these systems and frameworks, some were in place, but many have been created just in this short period of time. And that's just an information framework that we don't have in place. We don't have in place that every medical provider that conducts a test but gets a negative result reports it to public health. That's just not something that's in place. It's never systemically been needed or required. And so it's not that we have that information and we're not providing it, it's that we don't have that information. And as of right now, we don't have a system to collect it. Is that a fair summary?
I have one more question. Moore County reports 526 cases. We know it's a commute people from Amarillo to Cactus Plant every single day. It's a couple of buses leaving every 8 to 10 hours. Do you have a number? How many cases in Amarillo are workers from JB and Cactus? Because those cases doesn't count in Moore County because they live here in Amarillo.
Yes, sir. We have 110.
110
employees who work at JBS who were reported to be positive for COVID.
And those cases count in Moore County or Potter or Randall or where?
So all cases are reported by county of residence. And so if a person lives in Potter County, it's reported as a Potter County case. If they live in Randall County, it's reported as a Randall County case. And if they live in Moore County, it's reported as a Moore County case, regardless of where they work.
In other words, if that people get infected in Moore County and they come to Amarillo, they import virus to Amarillo, right?
Yes, it's reported by the county of their residence.
Okay. Well, I have several questions, but I think we are out of time, as Mr. Miller mentioned.
Thank you, Ramon.
Mm-hmm.
At this time, that concludes our news conference for today. Once again, we do these every Monday, Wednesday, and Friday at 11 a.m. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to thank all of our panelists for taking the time to provide this information to us today. We'll see everybody on Friday. Thank you.
Bye.
Thank you.
Thank you.
Thank you. Bye.